Hi, my name is Akeya Isham, and for my project, I decided to discuss the career physician assistant. To become a physician assistant, you need to have a bachelor's degree first, and you also need to have direct patient care experience in order to get into a physician assistant program. After you complete the graduate program, you have to pass the Physician Assistant National Certifying Examination exam to become licensed. And you have to complete 100 hours of continuing education in order to stay certified. And a couple examples of prereq classes to get into a physician assistant school are biology, general chemistry, organic chemistry, and anatomy and physiology. So PA programs are about 26 months or 3 years. A couple courses or topics you'll be discussing once you're in a PA program is anatomy, physiology, pharmacology, physical diagnosis, clinical laboratory science, behavioral science, and behavioral science. And you'll also do about 2,000 hours of clinical rotations. And the salary and job look of a physician assistant, according to ZipRecruiter, the average entry level pay for a physician assistant is about $80,000, and the median annual wage for a physician assistant is about $104,000. Yeah, $104,860,000 as of May 2017. And the Bureau of Labor Statistics states that the employment of physician assistants will grow 37% between the years 2016 and 2026. For duties and scope of practice, according to the American Medical Association, the scope of practice of physician assistant pretty much depends on the physician that the physician assistant is collaborating with. So, like, if the physician focuses on like psychiatry or whatever, the physician assistant will do that. So it all just depends on that. And the duties of physician assistant are to examine patients, prescribe medicine, provide treatment, and perform and interpret tests. The work environment of physician assistant, they work in well-lit and comfortable environments, and their schedules vary, but most work 12-hour shifts. PAs are on their feet, and PAs can work in multiple settings, such as hospitals or physician assistants' offices. Um, there are many like organizations for physician assistants, and these organizations have educational tools to assist physician assistants. A couple examples of professional organizations are American Academy of Physician Assistants, the Physician Assistant Education Association, and the Association of Family Practice Physician Assistants. So for my goals, I plan a job search by using a job search option for one of the physician assistant professional organizations. More than likely, it will be APA to help me find a job once I become a PA. And I also plan to complete internships and hope to be offered a job. And a couple preferred graduate schools. As of right now, I want to stay in the Florida area. And so far, I've looked at University of South Florida's program, Florida International Universities, and Florida Gulf Coast Community College program. So my 5-year timeline, for the first couple years until 2020, I just plan to complete my required courses and also continue working as a CNA to accumulate direct patient care experience for PA school. And by 2021, I would like to be I would like to be accepted into a program by that time, and also making plans to move into where I would be completing the necessary paperwork to be enrolled in that program. And by fall 2020, I plan to hopefully begin that program, and I also plan to be done by 2023. And these are my references.